Assalamualaikum student, welcome back. So we continue from the previous lecture. So we have discussed on physical examination. Now we go to management. So remember, in health clinic we don't have much time. So in the management part, you have to decide on the problem list. What are the problem list for the current presentation or the current consultation? Like previously, in history and physical examination, you need to prioritize which history and physical examinations are relevant and important for the current presentation. Similarly, in the management, you need to determine the priority of your management. Okay, before that, you have had your problem list. The second step after you have had the problem list is you need to determine the cause of the problems. For example, if the patient has acute flare-up of osteoarthritis, then you need to determine the cause of the acute flare-up. For example, trauma, excessive use, stress. Number 2, uncontrolled diabetes. What is the cause of the uncontrolled diabetes? For example, poor compliance, not following the dietary restriction, or number 3, inadequate dosing of anti-diabetic medications, lack of exercise. So these are the causes that contribute to the current problems of uncontrolled diabetes. And then, after you have sorted out the causes of the problems, you need to decide on the priorities in the management. For example, if it is an acute flare-up, then you need to give an analgesic, or probably later you want to refer to physiotherapist. For uncontrolled diabetes, if the patient has been compliant to the medication, has followed the dietary restriction for diabetes, then it is probably inadequate medication for her diabetes. So, in that case, you need to increase the dose of the medication or you add another medication for her diabetic management. So the next step is we need to discuss the options of management so that it is a shared decision making. For example, okay, you have an uncontrolled diabetes, and from the history we noted that you have been compliant to your medication and you have followed our diabetic diet. So we thought that the uncontrolled diabetes is probably because we don't give enough medication for your diabetes. So what we are going to do to you today is to add another medication. and discuss the reason why you wanted to add another medication on this patient. So, there are options. For example, you want to increase the dose, you want to add another medication, or if the oral medication is already maximum, you may consider adding insulin. So discuss these options of management with the patient, so that when the patient agree with your management, it is actually easier for the patient to be compliant to your medication or to your management. In the management, one is you need to prioritize which management option is very important or critical for this consultation. Number two is you need to consider multidisciplinary assistance and always include non-pharmacological management, if possible, in your management plan. For example, if this patient's uncontrolled diabetes is because the patient does not control her diet, then it is important for you to refer the patient to a dietitian so that the dietitian can help her manage her diet. Or if this patient has been on maximum antidiabetic agent and she refused to be put on insulin, you may consider referring this patient to an endocrinologist to add another newer agent that may help to control her diabetes. For her osteoarthritis problem, you may consider, like I mentioned just now, referring this patient to physiotherapist. Or if the osteoarthritis actually is so bad that you need referral to an orthopedic specialist, then you may do so. So remember, in primary care setting, we have the principle of coordination of care, where you coordinate your management with other teams, such as specialists in the hospital, other allied health science, such as physiotherapists, dietitian, occupational therapist, pharmacist. So that is one of our roles of a doctor in a primary care setting. And then if you remember, I'm using the approach of ABCD in this approach to chronic disease. So A, management of acute symptom, if there is any. B, behavior modification. C, management of the chronic disease. And D, disease prevention. So in this case, the patient has no acute symptom. Behavior modification is important to manage a chronic disease. For example, like I mentioned just now, if the patient has uncontrolled diabetes because of lack of diet control, because lack of exercise, because of poor compliance, then behavior modification and patient education is important. So after you have managed the chronic disease, you may consider disease prevention. Disease prevention or preventive activities or screening may have been covered in another lecture under prevention and screening lecture. So usually we offer screening or disease prevention activities when disease is under control, or when the patient comes with minimal or trivial acute presenting complaints or symptoms, because we don't want to manage so many things in one consultation. For example, if the patient just now has uncontrolled diabetes and acute flare-up of osteoarthritis, this may not be a suitable time for you to suggest on screening, because she has to handle her acute pain and she has to manage her uncontrolled diabetes. So there are so many things that the patient needs to handle in one setting. So wait until all of these symptoms and disease are under control. So when everything is under control, then this is the right time for you to stress on health education, understanding of the disease, behavior modification, stress and compliance, and prevention and screening. So, the prevention and screening, for example, are the cardiovascular disease screening and cancer screening. For example, if this patient is a lady or a woman, and if she is already indicated, you may recommend mammogram to screen for breast cancer, you may recommend fecal occult blood screening to screen for colorectal cancer, you may recommend pap smear to this patient. So these are the things that you may suggest to the patient. Remember, in the management of chronic disease in primary care, we need a multidisciplinary approach. Like I mentioned previously, in primary care, we are the coordinator of multiple teams to manage patients' problems. So, for example, a patient may need other healthcare support, such as occupational therapy, physiotherapy, dietitian. It can be from public or private setting. And then you always have to remember, in family medicine or among the principles of family medicine, in the management of patient, there are other support that is very important to the patient. That includes family support, psychological support, social support, financial support, and physical support. So please consider all these supports to your patient. So social support can be from social welfare department, homes like nurseries, and NGO. Don't forget to make full use of NGO. So that's all for now. Thank you for listening to my lecture on approach to chronic disease.